Hi everyone. Today in this video let us discuss one of the medications, Plecanatide. What is this drug Plecanatide? Plecanatide is one of the medication which is indicated for the treatment of chronic idiopathic constipation, commonly known as CIC. Here the term chronic indicates long lasting. So this condition presents for longer periods in the people, and the term idiopathic indicates this constipation is due to unknown cause. So in the people with long lasting constipation without any proper reason, it can be called as chronic idiopathic constipation. In such people, Plecanatide can be given to relieve the symptoms, and this drug is well known with its brand name Trulance. So this medication can be given in the people having no bowel movements, or in the people who are having hot bowel movements, which indicates constipation. In such people, we can observe few of the other symptoms like bloating, expulsion of gases from the mouth, some nausea and vomiting can be observed, and if it is untreated, it may also lead to loss of appetite. All these symptoms can be observed in chronic idiopathic constipation. In such conditions, Plecanatide can be given. It is available in the tablets form. Plecanatide is one of the guanylate cyclase C agonist, GCC agonist. So this drug can increase the bowel movements. In the people with chronic idiopathic constipation, we can observe decreased bowel movements. In such people, Plecanatide can increase few of the ions in the intestine. So this increases intestinal fluid secretion that results in the increased bowel movements. In this way, Plecanatide can relieve the symptoms of constipation, and this is one of the new medication which can relieve the symptoms of constipation. This drug is safely used in the adults for treating constipation, but in the children with less than 6 years, this drug is contraindicated. Similarly, this drug is not safe in the children with age 6 to 18 years. So in such people, again, this drug is not recommended. So it is better suitable for the adults with age greater than 18 years. So today in this video, we are going to see how this drug acts, what are the important precautions, side effects, doses, all these things we will discuss in this video. First of all, let us see how this drug acts. Within the intestine, GCC receptors are located. These are the guanylate cyclase C receptors. Now, Plecanatide is one of the medication which acts as agonist for these receptors. So when these receptors are activated, they can increase the activation of guanylate cyclase. This GC can convert the GTP into one of the active messenger, cyclic GMP. Now this cyclic GMP can increase the levels of protein kinase G, which is one of the protein which can increase the expression of ion channels, thereby it can control fluid secretion. One of the ion channel is the CFTR, cystic fibrosis transmembrane conductance regulator. This is one of the regulator which increase the entry of chloride ions into the lumen. So through this transporter, chloride ions can enter into the intestine. And another pump is available, that is chloride bicarbonate exchange pump. Through this pump, bicarbonate ions can enter into the lumen. In this way, both chloride ions as well as bicarbonate ions can enter into the lumen of intestine, which further increase the fluid secretion, leading to increased intestinal fluid volume. As the fluid volume in the intestine increases, it enhances bowel movements, which relieves the symptoms of constipation. Now let us see the precautions of this medication. One of the important precautions of Plecanatide is related to its mechanism of action. Since Plecanatide can increase the bowel movements, it can induce opposite effect of constipation. So in the people who are using Plecanatide, we can observe some diarrhea because of increased bowel movements. So in few of the people, we can observe some excessive diarrhea, which may result in dizziness, syncope, fainting, and some hypotension can be observed. Normally, diarrhea is a common side effect of Plecanatide, but if you observe severe diarrhea with loss of body fluids, then immediately the drug may be stopped, otherwise dose can be reduced, and replacement of body fluids can be done by administration of oral rehydration salts in order to avoid severe hypotension and dizziness in the people. Similarly, another precaution is that this drug should not be given in the children less than 6 years. Already we have discussed this point. The main reason for this is that children is more sensitive to this drug, because in the children on the intestine, the GCC receptors are more expressed. So plecanatide can produce more activity on these GCC receptors, which increase the loss of body fluids. So because of an excessive loss of body fluids in the children, plecanatide can produce some severe dehydration. This is a very fatal condition. That's why this drug is contraindicated in the children less than 6 years. Similarly, this drug can increase the liver enzymes, particularly it can increase the ALT, alanine transaminase levels, as well as AST, aspartate transaminase levels. The ALT levels may be increased up to 15 times and AST levels may be increased up to 5 times. So this is a common thing with plecanatide, and when this therapy is stopped, again the liver enzymes are restored. This is a temporary disturbance on the liver enzymes, but higher dose of plecanatide can produce some toxicity on the liver. So overdosing of plecanatide should be avoided in order to prevent any hepatic damage. Now let us see the side effects of this medication. The main side effect of plecanatide is the diarrhea. This diarrhea results in loss of body fluids, resulting in some dizziness and hypotension. With use of plecanatide, we can also observe some sinusitis, cold-like symptoms, and upper respiratory tract infections resulting in cough and wheezing. It can also produce some abdominal distension resulting in the swelling of abdomen and even flatulence, burping, and some tenderness in the stomach. Some abdominal discomfort can be observed with this plecanatide. How it is given? This drug is available as tablet and it is available at a strength of 3 mg. The initial dose is started at 3 mg given once daily, and this drug can be given either with or without food. The tablets can be swallowed as whole, otherwise they can be crushed and mixed with applesauce in such people who cannot swallow the tablet completely. So that's all about this medication, plecanatide, which is one of the guanylate cyclase C receptor agonist. This drug can increase the intestinal fluid secretion. It can increase chloride ion secretion as well as bicarbonate ion secretion, by which intestinal fluid volume increases. As the volume increases, it increases the bowel movements, leading to relief from constipation. So because of increased bowel movements, this drug can produce some diarrhea as well as abdominal discomfort and distension in the people. Because of severe dehydration, this drug is contraindicated in the children less than 6 years, and even the children with 6 to 18 years, this drug is not recommended. And this drug can be given as a 3 mg tablet given once daily, either with or without food. The tablet can be taken as whole, otherwise it can be crushed and mixed with applesauce. So that's all about this medication, plecanatide. Hope this video is useful to you. If you really like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.